webinar for your region this evening, and we thank you for joining. Tonight's session will be recorded, which you just were prompted to, so that we can share on the Birth to 5 YouTube channel for anyone who's unable to attend, or if you all wanted to show this within your community later. For our Spanish speakers, we are offering live Spanish interpretation this evening. I'm going to pause for a minute now for our interpreter to make an announcement and give those directions.
Hello, everyone. Welcome. This is Gabriela, switching to Spanish right away. Buenas tardes, ¿cómo están? Soy Gabriela, la intérprete de español. Bienvenidos y bienvenidas. Me gustaría darle las instrucciones de cómo pueden entrar al canal de español si así lo desean y si desean escuchar esta presentación en español. Para entrar al canal de español, si usted está usando una computadora, muy sencillo, vaya a la parte inferior de su pantalla, va a ver un globo del mundo allí que dice interpretación. Dele clic a ese globo y seleccione español o Spanish. Si usted está usando un iPad, está usando un teléfono o una tableta, toque la pantalla, va a haber 3 puntos que aparecen en la parte de abajo de su pantalla. Después, si sigue hacia abajo, va a haber una sección, una palabra que dice, o 2 palabras, lenguaje e interpretación. Toque allí, se va a abrir un menú con 2 idiomas. Seleccione español o Spanish. Una vez que haya seleccionado esa palabra, inmediatamente toque la palabra que dice D de dedo o NE, listo o finalizar, e inmediatamente se va a dar cuenta que seleccionó español porque va a aparecer en la parte de arriba a la izquierda de su pantalla. Si necesita asistencia técnica, por favor déjenos saber que estamos aquí para ayudarlos. Disfrute la presentación. Thank you, everyone.
Thank you. In order to make tonight's event accessible, we also are offering closed captioning. You can click on the live transcript closed captioning button at the bottom of your screen now. Closed captioning is being provided by Zoom, so we apologize in advance for any errors. We did switch from a standard town hall Zoom format to a live webinar tonight to ensure the most high quality experience for all attendees. Just to remind you, this is being recorded, so it will be available for you to view at another time. Our goals for tonight are simple. We just want to introduce you to the Birth to 5 team, share more about what the Birth to 5 councils and family councils will be doing, and answer any questions. Some of the information shared tonight may be familiar with some of you who have joined some of our previous calls, but there is lots of new information, so we ask that you're patient with us this evening. We also hope that we capture some new attendees tonight as well. While the chat is open and I see some of you all using it to introduce yourself, I want to just let you know that we will be asking you to put questions into the Q&A box, and so you can find that icon at the bottom of your screen as well. We will be answering questions tonight. First, the ones that were submitted with the registration for tonight's session we'll answer, then the ones that we get in the Q&A box, and last but not least, we will be answering questions from you live tonight. If you have a question you'd like to ask, please feel free to raise your hand and then we can unmute you at the Q&A section and you can ask your question live. Finally, for tonight, just to clarify, we are not giving any certifications, continuing education credits for tonight, but we appreciate you being here. Next slide, please. So since our kickoff, we have made a few adjustments to our work here, including providing a vision so that everyone's clear on what we're trying to achieve at Birth to 5 Illinois. Our vision is reimagining a more equitable early childhood education and care system that ensures family and community voice is centered and prioritized at every level of decision-making in Illinois. We realize that is a kind of lofty goal, but we're fully confident with your support, we can get there. Next slide, please. And the mission of Birth to 5, as it was created out of the Governor's Early Childhood Funding Commission, is to create a statewide regional infrastructure that will amplify input from communities in the development of policy and funding priorities. We will work to mobilize communities to build and sustain equitable access to inclusive, high-quality early childhood services for all children and families throughout the state of Illinois. So again, another lofty mission, but we are fully confident that you will get us there. Next slide, please. To go along with our mission and values, we did create some goals that we want to elaborate on. So we have family voice, racial equity, and collective impact. So family voice for us, we defined as through this transformation centered on authentic family and community engagement, we will address the inequitable distribution of resources and services and build our state's early childhood education and care system. Our work for racial equity, we defined as in an effort to move our early childhood education and care system to one where race is no longer a predictor of a child's success. We will address barriers that have limited access to high quality service for minoritized children in every corner of our state. And finally, we are using a collective impact model. So Birth to Five Illinois will build a system that harnesses knowledge directly from families and mobilizes the decision makers to ensure that new and/or expanded services are created to meet community needs and directly influence policy and funding decisions at the local, regional, and state level. Next slide, please. So for those who have joined earlier meetings that we have expanded our state team. So I wanted to introduce you to those folks. Everyone is not on the call now. We are running 2 community engagement webinars per evening, so half of our team is on another call. But as I introduced myself, Cicely, as the state director, Jess is on the call tonight. Jess works as our project coordinator. Sonia Clark is not on this call. Sonia's on the other call as the director of operations. Maggie is our communications manager, also on the other call tonight. Dina works as our community and family and community engagement manager. Dina is also on the other call, but Dina's partner is David, who works as family community engagement coordinator. You'll hear from David later. And Angela Hubbard rounds out our team as our grants and relationship manager. Those who are dealing, who are local collabs who might be with us tonight, will hear more from Angela at another meeting when she launches our funding for local collabs. In addition, we do have some area coordinators who you might have met through the work. Karin is on the call with us tonight. Karin is our boots on the ground in Area 1, which does encompass your area. Dana is in Area 4. Diana is Area 3. Kim is Area 5. Oh, sorry, did I get that wrong? My screen is so little, I'm sorry about that. Jackie we have actually as Area 3, I'm sorry, and Lori is Area 6. And so these folks have been working in the community as we've built our infrastructure and state team. And so you might have engaged with Karin or maybe even someone else, but they are always available if you have some direct questions and you don't know which staff member to reach in the state office. Next slide, please. So let's recap what is Birth to Five. Birth to Five is a partnership between the state of Illinois and the Illinois Network of Child Care Referral Resource and Referral Agencies, also known as INCRA. Birth to Five was tasked with creating Birth to Five action councils and family councils in each of the 39 regions in Illinois, excluding the city of Chicago. We are currently working with Every Child Ready Chicago to host a kickoff for the city of Chicago on April 6th. And that will really be a time for us to talk about what Every Child Ready Chicago has done and how they're going to align to become the action council for the city of Chicago, which is its own region. So please look on our website if you're interested in that. These councils will share the geographic boundaries with the State Board of Education, Regional Office of Education mapping, which you see there, which gives us the 39 regions. However, we will work independently within those geographic boundaries. There are several goals to our work that I think are important. We want to support local residents in coming together to address early childhood needs within their own communities, to make sure that the state's priorities and funding policies and funding priorities meet the needs that are identified in those regions, prioritizing the voice of family, provider, and community. We also want to provide equitable access to high quality early childhood services for all children, which we laid out clear in our mission and our values. We welcome people with a range of experience, including those who are new to advocacy and those who have been advocating for some time. We are in the process of hiring regional council managers for each of the 39 regions. Those jobs are currently posted on the INCRA website as well as our website. And after our April 6th meeting, we will be hiring for that Chicago office as well. We currently have several positions available, so I think there is a link in the chat if you're interested in finding out more about those, and we're always looking to bring great people onto our team. Next, I'm going to transition to David, who is going to walk you through a little bit more detail about the councils. Again, some of this information might have changed, so please be aware of this if you've been to a meeting with us before. Take it away, David.
Great, thank you, Cicely. Hi, everyone. Again, my name is David Quiroz. I'm the Family and Community Engagement Coordinator with the Birth to 5 team. So happy you're here with us tonight. So we're going to talk a little about the councils right now. We're going to start off talking about the Action Council and move into the Family Council right after that. So this slide here, the Action Council, we're looking to seat about 15 members and include a wide variety of experiences, not limited to the ones you see on your screen. I do want to highlight some. I will not read all of them, but parents and family members is the first bullet point you see there. That's the basis, the foundation of the work, right, of Birth to 5 is that parent voice and those family members. So we want to make sure that there is that representation in the Action Council. In addition to that, you're going to see Head Start staff, family childcare staff. You're going to see local school districts. You're going to see community elected officials, healthcare. You're going to see members of the faith community, among others. So it's a very nice, diverse mix of community stakeholders who are already doing a lot of great work in these different regions. And like I said, we do want to have about 15 of these members on that Action Council. So next slide, please. Great. So what will the Action Council do? So as part of the Birth to 5 Family Action Council, these community members will have an important leadership role within the team, driving the direction and the vision of the work. Each region will have the Action Council identify gaps in the early childhood landscape of that region. They will amplify the family voice, work closely with local coalitions that already do some of this amazing work, communicate regularly with the families, the providers, the family council, of course, policymakers, and other legislators in the area. They will connect with early childhood systems that support services such as housing and health systems. They will work closely with us, the Birth to 5 Illinois State team, the Action Council staff, the regional staff, the Early Childhood Transformation team, and other partners in the region. Most importantly, they're going to be conducting a regional scan or a needs assessment for that region with input, of course, from the Family Council. Again, they're going to create this annual report that makes recommendations to expand or create services for within that region. Next slide, please. So how do I join an Action Council? So to join your region's Action Council, you must live, work, or receive services in that region, early childhood services to be specific. If someone lives or works in another region, we do encourage them to apply to whichever region, city they think that their work would be most valuable, their contributions would have the greatest impact. Now, the Action Council is a volunteer leadership role. We do expect the councils to meet about twice a month. There will be some additional tasks possibly outside of these meetings. And we ask that members of the Action Council serve a 2-year term. Now, there will be the option to commit for 1 year to begin with, and then move into a second year at a later date. Family members, this is important, family members who serve on the Action Council will receive a stipend for their time and their experience. And that just goes back to what I said a second ago. The foundation of the work we're doing is to elevate that family voice, those family experiences, that narrative. So we want to make sure that it's something we bring to the forefront, and we are going to be providing that to them. Next slide, please. Perfect. And with that, we're going to move right into talking about the Family Council. So true transformation can only happen with authentic parent engagement, and that's why the Family Council is so important. So in addition to the Action Council, the Family Council will include a wide variety and a very diverse landscape of families, families that live all across the region, especially those targeting that priority population and in regions that haven't been represented in the past. Families who have children under the age of 8 or experiences within the early childhood landscape of that region are the families we're hoping to see on this Family Council. And family councils will also have about 15 members. Now, we might not start with 15 members, but we might build towards that. That's kind of what we hope to do. If a region has 5, 6, 7, 8, we very well could start with that and kind of build up. So next slide, please. Perfect. So what is the work of the family council? So this family council, right, they're going to be leaders within that region. They're going to really make a difference for children and families in those communities. They're going to be that advisory committee, right, to the action council. They're going to share the critical input. They're going to get feedback, advocate for the families that might not be seated at the family council, identify gaps within the region, and raise issues of concern. Again, elevate that voice, give us that narrative of what's really happening in that region. Next slide, please. Perfect. And who do we want in the family council? Again, families that live across the region, especially those in under-resourced or underrepresented parts of the region. We want racial diversity is key to what we're looking for. Families, again, who have one child under the age of 8 or have received services in early childhood recently. And also I'll say, maybe families who have not received services, who have tried, and for one reason or another haven't been able to take advantage of that. We would absolutely invite you to be a part of this. We want to hear the why, right? Families who serve on the Birth to 5 Family Council, as I mentioned earlier, will receive a stipend for their time and experiences. That's very important to us. We want to make sure we make that clear. And family members, again, like the Action Council, we hope that they will serve a 2-year term if possible. They will have the option to commit to 1 year and then on a later date, continue for the 2nd year. And why 2 years? We want to rotate the voices of families, right? We hope that as we work on this, things will change and evolve in those regions. We want to make sure we're getting the voice of those players who are being a part of that change and maybe taking advantage of new programs and things coming up. Like the Action Council, we anticipate there'd be about 2 meetings per month for the Family Council as well. We do have a flyer for the Family Council to start recruiting some interest, and we will make sure to put that in the link for you. You can also find it on our website if you'd like to print it out. Next slide, please. Okay, last but not least, we are looking to stand selection committees in these different regions to help us kind of comb through some of these action and family councils, interest forms. The selection committee, we ask that they also, again, reside, work, or receive early childhood services in the region. They're committed to early childhood education and care, obviously, willing to work collaboratively with others. And this is key. For the selection committee, we're looking for individuals who have not applied to be in either the Action or the Family Council. The selection committee is a volunteer role. The selection committee will likely take place shortly after we kind of close off or as we're nearing a good amount of interest per region in each region. And this work we only anticipate will take about 2 to 3 weeks, the work of the selection committee. And if you have any other questions, I'm sure we'd be happy to answer them now, but let's move on to the next slide. Perfect. Great. I'm going to transition to my colleague here, Karin, tonight to talk to us a little bit about community collaborations.
All right. Thank you so much, David. So again, good evening. My name is Karin, and I'm the Area 1 coordinator, which covers the regions that are represented here tonight. And as David indicated, we're going to talk about partnering with community collaborations. So the Birth to 5 Action and Family Councils are going to work as partners with the local collaborations throughout the state, both to help build capacity where possible and to also share information regarding future planning for the regions outlined throughout the state. The Action Councils and the Family Councils are not going to replace or duplicate the work of the local community collaborations. Ultimately, our goal is to make the community work easier with a new governance and funding model for early childhood education and care statewide, one that's actually based on the needs of young children and their families. So for those organizations that are already working on the regional level, our leadership team has engaged in conversations about aligning those efforts. And in those areas with more localized efforts, once hired, the regional staff will look to build on the work of those collaborations by ensuring the gaps, the barriers, and expansion needs that they've already identified are highlighted in the regional scan that's going to take place. In addition, through this work, there will be new efforts in engaging families and providers that have historically been left out. So it is our hope that the Birth to 5 Illinois is seen as a part of the community system and an additional early child care advocate. Finally, one of the really exciting things, I think, the carrot on the stick, is this $1 million funding opportunity that's being made available and will be launched in spring of 2022. Its goal is to help collaborations regain and increase enrollment in early childhood programs, especially programs that saw a decrease in enrollment as a result of the pandemic. We'll be having more information available as that gets squared away. Next slide. So Birth to 5 action councils and the family councils are going to be community driven. So the Birth to 5 Illinois is providing the infrastructure to ensure that there's equitable representation on both councils created within each of the regions. And we're ready to stand up the councils as soon as the community is ready. We need you and others in your community to complete an interest form so that we can see where the interest is and where we need to increase our outreach efforts. We know now, based on the interest forms that have been submitted, that we really need to focus our attention, especially with the Family Action Councils, but McHenry, Lake, Cook North, we need your help. So we ask that you, if you haven't already, hopefully as a result of today's session, consider completing an interest form, either for the Action Council, the Family Council, or even to be part of the selection committee. The Action and Family Council interest forms are available English, Spanish, and Polish on our website, and those links have also been added to the chat. So please visit our website to learn more about the work and how you can get involved. And we definitely want to encourage you to visit our frequently asked questions page, which was updated with the answers to the numerous questions submitted to our team during our virtual regional kickoff events in early February. Additionally, a reminder again, if anyone is interested, we want to encourage you to apply to one of the open positions. We're currently hiring 39 regional Action Council managers, one in every region across the state. Again, the position for the City of Chicago will be posted after our kickoff on April 6th. We are actively looking for an administrative assistant to join our state team, as well as a data strategist to support the data needs of the regional action councils. You can subscribe to the Birth to 5 email communications to stay in the loop and also connect with us on social media. Links to our social media platforms are going to be found at the bottom of our website, as well as at the bottom of all of our email communications. So this will conclude our presentation for the evening. Now what we're going to do is transition into the Q&A portion of tonight's event, and we will begin by answering any questions that were submitted to us in advance of tonight's session. And I believe we'll be moving back to David.
Actually, thank you, David. I have neglected to mention something in my opening remarks, and I apologize for that. We do have folks here from Cook County, and Cook County is one of those regions that Karin talked about when she spoke about alignment. There is a local collab in Cook County that covers the entire region, and so my colleague Sonia and I have been meeting with that leadership team. Our goal there is to just come in and provide some infrastructure and staffing support to the work that they're doing. Look to see if we can expand the council, bringing in a variety of diverse voices, as well as being able to move the state's priority in that regional scan forward. So part of this infrastructure plan is to provide staffing, and that is because we've seen across the state where local collabs exist, particularly, a lot of them don't have staff. They're using, one part-time staff, or people are doing it and their volunteer hours. And while that is meaningful and good work, it adds to the inequities that are shown around our state. And so the majority of our state has no local collabs, but where they do exist, we're not able to really understand fully what's happening because those local collabs don't really have it, always have the infrastructure and funding to do the work that they want to do. And so for folks who are here from Lake County, we do recognize the work that's been done right now, led by John and I Grow Lake County and lots of private funders. But we are working with them to see how we can add to and build up the work they have been doing. So those conversations are ongoing, and I'm sure John will pull together his all of the conveners there, and we'll have more of a public meeting like we're doing in Chicago next month to just kind of lay out what that looks like for that council and that region.
Yeah, great. All right, so now we are going to move into the questions that have been submitted ahead of time for those of you who have registered for tonight. We've got quite a few, so I'm going to ask Cicely to kind of bounce back and forth with me as we go through some of these. But before we actually go into the questions, I wanted to mention we have received several questions about child development, early childhood, educator compensation, childcare assistance, data, program funding, etc. A lot of these things do not necessarily fall within the purview of Birth to 5 Illinois as it stands right now. Remember, Birth to 5 is really creating that structure, right, to gather again that family voice, that parent narrative, and elevate that. We encourage you, if you have any questions like that, to please visit the Illinois Cares for Kids website, which is the state's early childhood kind of consumer education website. A lot of information in there to see if your questions might be answered or linked from there to another department or another site. Okay, so we're gonna jump into the questions now. I am gonna bring them up so I can read them. Okay, so pre-submitted questions we actually got some about educators. So will teachers, paras, early intervention therapists, and other educators who work directly with children make up a large part of the council along with family members? And along that, will teachers be a part of the action councils? Great question. I recognize one of the names here tonight, who is an educator in Lake County. Hi, a friend of mine. We absolutely, I think I speak for everyone on the team, want to have educators in the family or action council. It's important to us to have all those voices. And like I said, those school district staff were mentioned in that first slide that I spoke on in the action council, not saying that we can't have educators who maybe feel like their voice and their input might be more valuable in the family council as well. So do we have a slot accounted or taken for them? We don't. We absolutely want to mix. We can't guarantee that every action council throughout the state will have an educator, but we hope there's a school district principal, superintendent, and I know our area coordinators have been doing a lot of work in reaching out to some of these and having these meetings with superintendents, and we're working and making it part of our plan to continue to reach out to school districts, not only to get the staff to know about the work we're doing, but also the families. So great question. The next one I'm going to pass over to Cicely. I'll read it for you, Cicely. I'm curious how the regions were identified and why the LAN boundaries weren't used, as they already exist and cover related geographical areas.
Well, thank you. That's a good question. And so I'll just be very honest. And so Birth to 5 launch with me coming in about 6 months ago, and between now and then, and I think the original kind of conversations around it, we have pivoted some things just because we've heard from the community what makes sense to them. I was not aware of earlier conversations regarding the LAN or LAN boundaries. I am familiar with them from other work, and my understanding of them is they kind of fall more into the health side. Our goal really is the early education, not that we discount health. Children need to be healthy and have access to healthcare to do well in any learning environment. But the thought was to build on the regional offices of education, because again, kind of partnering education to education, trying to think of where some people might be familiar with in terms of this new idea of even the new boundaries we're working with, and building off of kind of the educational landscape there. And so I think there are many maps that our state uses. Karin and her team are on an entire different map system. And so we think that the thought was kind of pick one that might make some sense. And as we build this out, we can continue to educate people on what is happening within their geographic boundaries. And then David, I think the second question here is that I thought there was to be a state level council with representatives from all 39 councils. Is that still a plan or has that changed? So similar to the other question, that was not a plan when I came into this space. I imagine that probably was tossed around. At this point, our plan is to have these regional scans and regional councils, all, as we said, working across the state, and then the information will filter up to our office. And so at the regional scans, when they're done, we will compile them all. We'll have an entire state narrative that everyone will have access to. If we change, if we decide later on after, a year or so of this work that we need to have kind of a statewide council, we will have the ability to pivot there. I know there's been conversations around that from the family side too. So I think as we build this, we still have room for improvements as we reflect on our work, and we plan to do that continuously.
Our next question, and Cicely, I'm going to pass this one to you as well. What are some of the deliverables for the Birth to 5 Action and Family Councils?
Sorry about that. So the deliverable of the first year is very simple because we are considering this first year from now until December, so it's a short year, is really to do that regional scan. And so some folks, like as I mentioned, John Ashworth is on in Crawford Lake County. Some municipalities and some local collabs have started some work, sometimes through Action for Children as well. But this regional scan will go a little bit deeper. We're going to look at the data points that a lot of people are familiar with, try to dig a little deeper into data, but really want to partner this with the qualitative data. So what is the experience of the families, providers, and parents? And so what are the barriers to services? What are they looking for when we talk about expanding services? And we know that's all regional specific. And so really the goal of this first year is to complete that regional scan, pair that with the quantitative and qualitative kind of data, and then have a clear picture across the state of what's happening in each region. And then to meet the state's priorities, which is really to increase enrollment, we are going to look at those regional scans, and each region can kind of identify for themselves based on what parents and providers have told them what expansion looks like in their community. And then our staff will be there to help work them through that implementation and expansion plan.
Our next question is, what is the state of Illinois already doing to encourage parents to take their young children to enroll in early childhood programs? So the state is currently running a statewide early childhood awareness and enrollment campaign that focuses on family and community engagement strategies that promote the importance of early learning and early childhood education. This campaign is actually expected to launch very soon. As part of the efforts of this campaign, the Illinois Cares for Kids, the site I mentioned earlier, that kind of consumer education website for early childhood, is inviting all families to join Ready for K, which is a free research-based text messaging program for families with young children. Families can expect to receive about three text messages per week with fun facts and tips and tricks on how to engage with your children as they grow. Families can join now and sign up. We'll put the link in the chat for you to be able to find more information on that. And another question, I'll take the next one, is what is the time frame to stand up the Birth to 5 councils? When can we expect to see some of the implementation of their work? Great question. Birth to 5 is providing, like I said, that statewide infrastructure, the staffing, the framework for communities, for these regions to get this work done. Councils will be developed based on community interest. There is no state timeline as to when we need to have X region up and running. We're going to drive as we see the interest build. We're going to formalize action councils and family councils when the staffing positions are filled, first and foremost, and we meet that diverse community perspective that we're looking for in these councils. Okay. Our last question that was submitted ahead of time is, and this is, I'll pass this over to Cicely, is why is the data on your website and the data you shared in your February kickoff outdated?
I'm going to add to that because we also have a related question in the Q&A box, just so you know. The regions are quite large and diverse. Do you think the reports will look at the data for the region as a whole or in sections?
All right, well, let me take the first one. So the data we use for the kickoff and the data that is currently on our website came from ICAM, the Illinois Early Childhood Asset Map. And so ICAM is a public data source that anybody can look at, but the ICAM map does not have early care and early education data for the current year because ICAM receives the data from the state agencies near the end of the fiscal year. So they pull the demographic information from the census that is typically updated also in a different timeline, and then they use that with the data provided by the state. So the data we have is old, and sometimes it's, doesn't kind of pair up with what might be happening in your community based on data reporting. This is another reason we really want to make sure we're working in community. We have the data sources that we have throughout the state of Illinois for right now. We can also make sure we have the parent and provider qualitative piece. But then also being in community, we can talk to the care providers in the community to ask what their data is. The goal for the state of Illinois is to have a better data set for all entities. We're not there yet. And so we're going to make the most of what we do have. We will continue to work with ICAMs as they are sourcing the data and putting it into regional kind of maps for us. We'll also continue to work with Illinois Action for Children on data. Unfortunately, it's just not a great data picture in the state of Illinois with all the different sources and the reporting timelines. And then when that data can be made available for the public. So we'll go more into just the data piece on with ICAMs in action in the councils to have more training available so people can understand what we're working with. And then the question that was in the chat, which I think I have forgotten already.
I'll reread it. It was, the regions are quite large and diverse. Do you think the reports will look at the data for the region as a whole or in sections?
It will look at data for the region as a whole, obviously just based on where we find the data. We can pull some school district data, some census data, that both are looking at different things, and then whatever data we have from early learning community. But when we put forward like this regional scan, it would be the whole community. Definitely there's space for narrative. This is not just kind of a one-page document. And so if there are things that make other counties or municipalities within the region stand out, we can definitely highlight that. And again, this will be a document that we're leading through action, but the communities will make their own, right? And so we want to make sure everyone can put in whatever narrative that makes their community unique and things that they want to highlight for the state. Right, looks like, are there more questions here?
Questions?
I think Jess is answering a few of them.
Yes, and I'll go to my portion, David, if you're done with all of yours.
Yep.
Yes, and Gail said hopefully the individual communities can contribute to interpreting the data at the local level. That's one of the biggest things that I see personally that these councils are going to do is give real voice and a real story to what that data means, because data is skewed in lots of different ways and very hard to interpret if you're not directly impacted by it. So yes, thank you for that comment. I am gonna go ahead and read the questions that we got in the Q&A box, both for folks who don't have access to seeing or are unable to see the Q&A box, and so that they can be interpreted into Spanish. So please be patient for a sec as I go through these. We already explained that you were all muted. I shared some regions, regional information. Someone was curious if Palatine is indeed part of Cook North Region 1 BD, and it is. Some greetings. Someone in Spanish said that they were a child care provider and they wanted to know how to be a part of the team. And so I gave links. This was an anonymous person. I gave links to the action and family councils in Spanish. If you have further questions about how to be a part of the team after our presentation, please let us know. Lindsay wanted to know if you can recommend a family, and Cicely said, yes, definitely, David. Have them email David. I will repaste in the chat box his email address as well, or you can use our contact form on our website. Anonymous wanted to know when our interest window will close. And so as David answered, once we have all the spots filled on the council, we will keep them open until they're filled. Couple more here in the Q&A box, and then I'll get to the newer ones. You can also raise your hand. I'm going to call on you in a second, Elise. How many teachers will be on each action council? there's a minimum reserved spot for at least one. I linked to all of the other roles that we're looking for on each council to be diverse, not only in the roles they hold, but in terms of race and gender and ethnicity and geographic location. Make sure all the counties in the region are represented, socioeconomic status, all of those things. And then why would you, okay, here's a question for our team to go in more depth maybe. Why would you prefer to have a school district representative instead of a teacher on the Action Council? Wouldn't it be better to have actual teachers, paras, therapists working with the children in schools to discuss their and their family needs? I said, we don't prefer a district representative over a teacher. It's exactly what you said. We want people who are directly impacted to be centered and prioritized. Perhaps we misspoke previously. And then I let this person know we'll read the question. So does anyone want to add anything? Why we maybe previously said we wanted a school district representative over a teacher?
Yes, I can address that one. So the slide that David went over in terms of kind of the voice that we have been, not the voice, but the voice and perspectives that be on these councils is not all inclusive. I mean, it just kind of really, I think the goal of that was to highlight people who aren't usually engaged in early learning conversations. So you think about a mayor or a school district, ROE superintendent or someone like that. They're not always engaged in early learning, particularly if for the school district, they don't have early learning in their buildings. And so really what that was trying to show is we want a really diverse group of people, not just people currently involved in early learning. Obviously, we prioritize them, but we want to expand this conversation so that many people in the region understand the importance of early learning. So the advocacy for expanded care, the advocacy for expanding the workforce is not always on the parents, teachers, and providers, right? Because we know, particularly coming out of the pandemic, a lot of the providers are doing several jobs. The parents are just trying to find care a lot of times. So we want to expand this so that many, particularly decision makers, elected officials and such around in the region are committed to this. And we look at those plans in terms of what the community wants in terms of expansion, and those people are already committed to that, right? And so it's not as heavy as a lift to say, okay, we've decided X, Y, and Z is our priority for expansion in our region, and we have a mayor or elected official at the table who we then can ask, how can they help us meet that goal? And so they're not an afterthought, we're bringing them to the table. And so in terms of the teachers or paras, yes, we definitely want to have them involved. We definitely have, talked to several educator groups at this point and communicated that. I think that we want everybody really to be involved, but we just don't want to have a council that's so big that staff really can't get to the meat of the matter. And so there are going to be plenty of times for us and our staff to be engaged even outside of the folks who are sitting on the quote unquote council to make sure we get that community and parent voice involved there.
Thank you. And I have just a couple more in here to read out loud. When will the interest forms be reviewed by the selection committee? Will be as they come in or held for a particular time? And I said, once we have a solid amount for a region, the selection committee will review them all at once. And then someone asked if you can apply for 2 different areas, meaning if you work in one and live in another, can you apply for both to see which you fit best in? And I said, we ask that you choose which region you think you will have a bigger impact for and fill out the interest form for that one. We have a few more coming in the Q&A box that we'll type to and address out loud, but Elise, you had raised your hand way earlier. I'm gonna unmute you to see if you would like to still speak.
It must have been an accident, sorry.
No worries.
Thanks.
So that's what it looks like. If you click the raise your hand, we'll unmute you and you can also speak out loud. So Karin, let me give you a chance to do your little spiel too. I know you always have something cute and really helpful to add.
Here's my spiel. No, first of all, I want to thank all of you who are participating this evening, and hopefully the information that you've received. If you haven't already made a decision regarding submission of either a Family Action Council form or Regional Action Council form, hopefully, again, this information will help you make a decision about moving forward but please know that I am available if you would like to have further discussion. I also want you to consider there may be other people in the community who we have not yet reached out to, who you feel would benefit, who you feel would bring voice to the table. I think I saw something in one of the questions that was asked, and let me look at it real quick. I think it was one of the last questions. The not-for-profits, right, and for-profit EC centers, family home programs. If you know that there are people within that realm who don't know what's going on and should know what's going on, then I want to encourage you to please share my information with them, forward the link to them. Again, we're looking at a myriad of people who represent the community to be part of the Action Council. So if you are connected with people within the Chamber of Commerce, local business people, bank individuals, whoever they might be, to bring the voice of the community into the space, it would be most appreciative. And again, based on the interest forms that are in now, we still have a ways to go. So I definitely want to encourage you to spread the word. And I can't say enough to please reach out to me if you are in need of clarity or some more information. I'm available to follow up.
Thank you so much, Karin. And there was a question that came in the chat about asking for a flow type of chart of how all the pieces fit together, the major purpose and position roles, a tool that can be presented to community members trying to see the big picture. Is there a document that would address it? And I know we have our little chart that shows how everything's connected non-hierarchically, but what I know of personally doesn't list specifically the major purposes. So Cicely, maybe Karin, David, do you all know of a resource like this?
And I guess I want to make sure I understand this. Is this a flow chart in terms of how Birth to 5 envisions itself working throughout the system, or is this like the larger ECEC landscape and then showing where Birth to 5 fits into there? I just want to make sure I understand the question.
Jean, it was from Jean, if you want to clarify. Oh, wait a second for that. I think that person maybe left. Oh, no, there's the hand up. Okay. Nope, I clicked Amy. Sorry, I'm having some technical challenges. Jean, I will unmute you. There it is.
Terrific, thank you. Can you hear me now?
Yep.
Okay, I'm looking at, as we try to get the word out to our community about the efforts that we are having to improve a system and to get the system to be more serviceable by all the people in the community. How do we represent not just Birth to 5, but the big picture of how all these councils will fit together and how they will reflect in hopefully improving access and improving the ability of people, parents, and people in the community to be able to access programs and to know what's going
on. So I can answer that. I think that is the $1 million question, right? And so as we're launching this, an effort to provide equity, and then, as you said, provide clarity for parents, we're also standing by and talking to DHS, who has recently launched the Division of Early Childhood, I believe. I might have that wrong. And so as they're building, we're also trying to make sure we understand exactly what might change over there and how we fit into that, and then having similar conversations with ISB. So I dare to say we could provide you some kind of graphic of what we think it should look like, but that is probably not what is on the table right now. I think part of what people as yourself have understood is that it's kind of all a little bit messy right now, with what seems like maybe a lot of duplicates in services if we're not very clear on what we're each doing. And so I can tell you that we'll do our part to make sure we're very clear. And as information comes out of DHS particularly, we will communicate as much as we know in terms of how we might fit into their greater picture. I know in terms of like the the talks we're having with Lake County and other regional collabs, we're also having conversations like that with AOKs to see how we complement each other, how we work in the same space together, and how we can make sure that our staff is educated to communicate who's doing what. I think in terms of the parent community, what we hope to do is in communities where there are active parents is to build onto that. We do think there's probably enough parents to build a council, but we realize parents aren't always rushing to join new things. And so partnering with local entities who already have parents, so we can, join forces with to ask those parents or tap those parents for their input, versus trying to start something new that just, maybe confuses or exacerbates parents. So we're trying to get there. That involves a few more entities than ourselves. But if we do find something that makes sense, at least for right now, we will be happy to, add it to an email or share it with folks. I know that there's an enrollment campaign that's coming out, also through INCRA and GOECD. And so hopefully those kind of materials will also provide some clarity. I'm not sure exactly what they look like at this point, but we will continue to push for that and produce what we can on our side.
Jean, did you have a follow-up question or?
No, I'm satisfied that you're working on it.
Always our hardest, thank you.
Now, Judy, to your point, Judy asked, is there a list of every program and what it does? That would be helpful. There is a list that exists there. If you would be so kind as to send us an email, because I might not remember tomorrow, we can look for that. That way we can try to get you that. Again, it wouldn't be something that we produced, and so I'm not sure how up to date it's been. And I know on the Partner Plan Act website, I believe through Illinois Action for Children, they do try to lay out kind of an early learning landscape as well.
We had another question in the Q&A box of when Angela, our grants and relationships manager, will be releasing the information, more details on the grants. And we are hopeful that this will be out in April, May at the latest. So stay tuned for that. I'm seeing that I think we covered all of the questions in the Q&A box. Any other questions, feel free always to type them or still click the raise your hand if you want to be unmuted. And as we wait to see if there's any last questions, Britton, if you can pull up our last slide, we'll start closing out. We love ending on time, but please do not hesitate to type or raise your hand if there's still more questions.
And actually, I want to just read out loud one more thing that Gail Nelson typed that I think is helpful, to think of this less as a governance, who's in charge, and more of a collective impact where everyone's empowered. That's definitely why we have that as one of our values and goals. I will say I do want to recognize that we've been working for a very long time in the state of Illinois under governance, and we still have governance. And so we understand that's the question people have, and we are, as I said, trying to work and understand that ourselves as DHS, particularly builds this new division. And so we do love being kind of quasi-government. It allows us to move a lot faster and launch a lot quicker. But we do understand that, until something else is designed, those are the structures we have. So we're trying to make sure we can just do our part to bring provider and community and parent narrative to the forefront of government decisions. So it looks like no more questions that I'm seeing. Jess, can you just put my email address or info at or something in the chat, and so people can continue their questions there, or if there's something that I just committed to getting to you, I can remember to do that. We do have our website. We try to keep it, Jess does a great job of updating every day, and so it is as up to date as possible. But being that we are a new entity, we try to keep it focused with just things that which are under our purview, with lots of links to other things. And so please think of it almost not quite a clearinghouse, but you can go there and find a lot of information. But we do try to keep it open and honest to what we actually are in control of at this very moment. And so we looked at these earlier, just another call. So if I'm looking at our form here, which Jess I know did put into the chat early on, but in Lake County, we have 13 applicants for interest forms for action councils and 3 for family. In Cook County North, We have 10 who have put in an action form, an interest form for Action Council, and I think 2 for families. And in McHenry, we have 7 for Action Council, 1 for family. As we said, we are ready to stand these up as soon as we can. And so as we're interviewing and hiring people, we will go ahead and go to seating the councils. While David did mention 15 is kind of what we think is a sweet spot in terms of a council that's not too large and not too small. We can start a council with 7 people. So I don't want McHenry to feel like they have 7 and therefore they have to wait. We can, start with 7 and we can build on you all. The 7 on that Action Council will be our ambassadors and help working with Karin and other folks to build that council out. And so we don't have anything that prohibits us from starting with 5 or starting with 16. We just kind of have that out there as what we think is a good reasonable number. Same thing as in terms of family councils, we want to stand those up at the same time. However, if we have 3 people who are interested now, we can start with those 3. They can help us build, the staff can help us build, and we can add on. If there's ever an area that we don't have enough families or enough interest to actually put in the stand up in a family council, David and Dina will do that work of meeting with community, trying to gather that family voice. Our staff will do that work. And so we won't officially have a council. We still do have a pledge and a commitment to getting as much family and provider narrative and opinion into these scans as possible. And so that just will be done in a more, a less structured way, I guess I can say, in those areas. But please, I don't want anyone to feel like, oh, we don't have enough people, we can't move forward. As soon as we have staff, we are ready to move forward. We will trigger those selection committee applications. If there's no selection committee, then our staff will likely use a equity matrix that's being created now in the state to look at those forms. And again, it's really just looking at those forms to make sure we have the diverse group so we can, as we add people on, they can bring a different perspective that's currently missing. So I don't see any more raised hands. I don't think I see any more questions in the chat or the FAQ. So before we close out, I just want to make sure we get to everyone's question. Just did add my email there. Thank you. John says he looks forward to meeting with David and Dina next week, and Karin for the selection committee. And he thanks us, and we thank John and the other folks who are already working in the community for welcoming us and letting us help to expand their voice in the state side.
Yep. Thank you, everyone, for being here.
Thank you, everyone.
Susan,
Thank you.
thank you. Have a good night, everyone.